I get your name, please? Polyloma? Okay, I'm gonna need you to update your information for me. Okay. Just go have a seat over there. Okay.
Miss Polyloma, the doctor is ready to see you now.
Okay. Hello, Miss Loma.
Hello.
How are you today?
Well, I'm doing okay.
Yeah? Okay. Just go ahead and lay back. Don't be nervous.
Okay.
This is just gonna take a moment.
Alrighty.
Scoot your butt forward, please. Thank you. Okay, and have you seen any good movies lately?
No, not particularly.
No?
Nope, but that Ryan Gosling's quite the babe.
Oh, he is. I'll just tell you. He is something.
He is.
Alrighty, we're all done here.
Oh, wonderful.
See, that wasn't so bad.
It wasn't that bad.
Okay, I'm gonna go ahead and take a look over your results, and I'll get back with you within the next 10 to 14 days. Is that okay?
Sounds perfect.
Okay, I'll see you
Alright,
later.
bye-bye.
Etiology.
HPV, also known as the human papillomavirus, was first discovered by Harold Zur Hansen during his studies that he conducted in the 1970s. It comes from a heterogeneous family of viruses, and currently there are 100 different strands known. Now, only about 30 of them are considered high risk or which can cause cancer, and those are especially known for strands 16 and 18. Now, what many people believe is this is a virus that only affects women. They are very incorrect, however. It can also affect men. So this is some information that men need to know as well.
Hi, could I please speak with Miss Polyloma?
This is her.
Hi, I just wanted to let you know that your Pap results have come back, and it turns out you have abnormal cells on your cervix.
Oh no. What is that?
It means that you have tested positive for HPV, human papillomavirus. This is a very common infection, and there's no need to rush to conclusions. Many young women can contract this, and even some men. Luckily, we have found ways to treat this infection for women like yourself. In order to make sure that you in fact are HPV positive, though, I would like to perform a colposcopy. Could I have you come in sometime this week?
Yes, of course.
All right, I'll have someone call you and set up an appointment.
Thanks so much.
Thank you. Bye-bye.
Diagnosis.
As seen in the video, HPV is generally first noticed when results from a pap smear are found to be abnormal. The doctor will then perform either a DNA test or a colposcopy in order to determine if the patient is in fact 100% positive for HPV. The doctor may initially be suspicious of HPV if they observe warts in the genital region. A colposcopy is performed through use of a colposcope, which shines a light and magnifies the view of the cervix. A vinegar solution is then placed on the cervix and turns abnormal cells to a white color so they can be more easily viewed. Hello, and how are you?
I'm doing okay. I just, let's get to the results.
So we have the results from your colposcopy, and we are 100% sure that you are positive for HPV.
Pathogenesis.
HPV occurs at the basal epithelium, and although chance of infection is very high, most infections usually resolve spontaneously. There's a small portion of people that become persistently infected, which is most important risk factor for the development of cervical cancer precursor lesions.
I don't want you to worry though, because you have what we call low risk HPV, which means that you have little to no risk of developing any sort of cancer.
Clinical features.
Most HPV infections are asymptomatic, which means there are no symptoms, and they also result in no clinical disease. Some clinical manifestations of HPV include anogenital warts, recurrent respiratory papillomatosis, and cancer, whether it be cervical, anal, vaginal, vulvar, penile, and also some head and neck cancers.
Well, I guess that's sort of good news. How could this have happened?
Well, generally HPV is transmitted through genital contact, most often through vaginal intercourse. Your partner could have given it to you and been infected without having known that he was even carrying the infection, showing no signs or symptoms.
Transmission.
HPV is generally transmitted through genital to genital contact as well as anal, vaginal, and oral intercourse. It can also be transmitted through same-sex partners as well as heterosexual couples.
Oh my gosh. But it's curable, right?
Unfortunately, there is no treatment for the virus itself, but there are treatment for the health problems that HPV causes.
Epidemiology.
HPV is a universal infection. Humans are unfortunately the only natural reservoir of HPV. There's no known seasonal variation in HPV, but risk factors are related to sexual behavior, including number of sex partners, life history of sex partner, and partner's sexual history.
Treatment.
Treatment when needed is only to relieve symptoms by removing any visible warts and abnormal cells in the cervix. Treatments include cryosurgery, which is freezing off the warts with liquid nitrogen. Laser therapy can also be used using an intense light to destroy the warts and any abnormal cells. Prescription cream can also be used by applying medicated cream directly to the warts. Be careful and do not use over-the-counter wart treatments on the genital area.
Oh, well, I mean, I guess it's good that we caught it early.
It is. It really is. But let's set you up an appointment and get you scheduled so you can come back and we can start your treatments.
Oh, thank you so much.
Prevention.
Ways of preventing HPV include abstaining from sex altogether and then having safe sex when not abstaining. There are 2 vaccines that both men and women can receive in order to help prevent HPV, and that is Cervarix and Gardasil. Now, what is very important to know is that, yes, while there are vaccines out there and are methods of prevention, it is more about the information getting out there to both men and women for them to know about HPV and what it can cause. So the more you know is the best way of prevention overall.
Trouble maker. And I wanna know why